if you look back in late March, you will see that due to the general holiday and stoppage of all the mass transports, we saw some disruption in the market supply in the beginning. But in due course, government, you will appreciate that government brought that back. You see, the situation got back because of special arrangements, food movements, and other emergency movements. And that is also reflected in the price. If you allow, I can share the market price since January to June. I think that will reflect a better picture. If you allow, I can share the screen here.
Yeah, please go ahead, sir.
Just look at the price of almond coarse rice. That is the wholesale price talking about. In January to June, you can see that price of almond HYV coarse rice and also almond coarse rice, it went up. Is because of the seemingly supply shortage and because of the apprehension that because of the COVID, maybe not only the movement stoppage, but also an apprehension element was there to trigger the price to go up. And in April, since April to June, you can see this price is dropping. That means has been dropping. That means in the first phase of COVID, the apprehension element actually impacted much on the price of almond coarse rice. But this is not equally true for other prices. Say, for example, cucumber. The trend has always been in the down. It's because of, you see, it has a different sort of scenario. It's access from the part of the consumer and access from the part of the producer as well. So from the producer's point of view, they did have limited access in the beginning, and that triggered the price to go down. And if you talk about, say, for fish that is taken usually by the extreme poor and low income people, the pangas, you can see the price. It went up a bit and then it went down. That means initially, because of the apprehension, the price has a trigger to go up and then it went down. So, say for example, the egg, again, it's same. The fashion is same as in the case of fish. And for eggs, it went down and then went up. So the access, if you ask me in terms of price, the access situation of food was mixed. For some commodity, the access was difficult, but for some commodity, the access was not that much difficult. But if you talk about the income, see, definitely in the beginning, maybe the income situation was not that much affecting the access. But as the time passes on, you can understand the informal sector, the people who work in the informal sector, they might have been having a tough time in terms of maintaining their income. And that has been reflected in many of the studies in Bangladesh. I am not fully acknowledging the extent they have come up with the results, but it is apparently, if you talk about the direction of income, that definitely has fallen down. especially for the low-income people, especially for the people who work in the informal sector. So that is generally the case, and I think that is not different for the women and the children you were talking about.
Right.
So I stop here. Thank you.
Yeah, thank you, sir. So your figure, as you shared this data, it shows that it's not only that excess of the people as well as the production. Those are living in the outside of the Dhaka or rural areas. They also need producers. They need the access to send their product into the market.
Yes, access to market was important, and you have seen the initiative of the Agriculture Ministry, and that was remarkable. To me, that was remarkable in the sense that they provided farm laborers. They ensured the farm labor movements from one place to another. They provided a special movement vehicles for the producers to come to the growth centers, especially the major cities. And not only that, they tried to make the linkage live. That means before the COVID, we did not have seen much online marketing system. But once the COVID started, we can see plenty of online supermarkets. It's not only the physical supermarkets like Agora or Shopno or others, but we can see plenty of supermarkets. They're working online and providing necessities to the people in the urban areas.
So in this case, if you look at this, producer access as well as people access, I just want to go another perspective of this, information. We know that there is a intervention for COVID-19 issues to give the information for the people. We call this is a risk communication. I just want to know from Tushar Bhai, if you look at that, risk communication should not only, my perspective is, should not only give the information related how you will maintain the lockdown, how you will maintain that social distancing, but you should also give the information about what type of food you have to take, what type of feeding behavior you have to maintain. So do you think that risk communication cover these issues, or maybe what is your understanding about this risk communication in Bangladesh?
Basically, if you ask me about risk communication, I have seen that was put on the lowest priority in the different offices. Even you see, if you look at the institutions which are responsible for communicating about food, nutrition, and other health issues, they have miserably failed in communicating the right message to the right people. And also there was a denial syndrome, and there was a perspective difference. When I saw just the graphs shown by Dr. Ruhul Amin, you see that the almond price rose, and then it actually stayed almost flat. So the riser price is there, it's not coming down. It's just a bit lower than the price hike, the highest peak of the graph. But if you look at cucumber, the demand of cucumber actually fallen down, because cucumber is usually sold not to the household use or the consumers, but a huge amount of cucumber is bought by hotel, restaurants, and cafe, because the cucumber is served as a free supplement with the regular order as salad, and that comes as free. So dal puri sale closed down, Piazu sale closed down, Shingara sale closed down, all restaurants are closed down. So cucumber demand has actually fallen down, and that's why the price of cucumber actually fallen down, because it's a perishable good and people cannot store it. Even cold storage, storing it in a cold store is basically very costly. So this is the perishable good, and people are selling it for no price. Then if you look at the lowering down of price of pangas and egg, that is really very alarming, because pangas is being cultivated on a professional basis and in farms in different areas where agricultural investors, especially low-income investors, have invested a lot of money. So if the price of pangas falls down, the production price, then next year you're going to have a protein deficiency, protein shortage in the market. Maybe there will be no COVID, but people will not be able to invest in the pangas farms. The same goes for eggs. So there should be some kind of a price control mechanism in the market. Just ensuring supply does not actually protect the farmers and does not actually gives us food security. You also have to have a balance, and you also have to have a certain kind of market price control mechanism, where the producers actually don't lose money this year. Maybe they will not be making the same profit like last year, but we have to ensure that they get their investment back. So for, the lowering down of pangas is actually not a good news, rather it's a bad news. So we have to think or look at graphs differently, I think. And the other thing that you have asked about risk communication, you just go to Institute of Public Health and Nutrition website, you will see what kind of communication is over there. Nobody has to actually explain anything. They have not changed their cover photo in last about 3 years. And the same photo is moving there. If you can just take a time and go there, or I think I can share screen here, maybe. I'm not sure, but I can tell you. There is a coronavirus do's and don'ts, and then some tenders, some job circulars. There are some rules and regulations, but nothing is there for the people to know about what kind of nutrition they should look for and what kind of food they should look for in this crisis situation. So isn't it their responsibility to create communication material for the regular people, for the mass, so that they can be well informed, aware, and they can take decisions according to the budget. And I think all the videos were basically some health videos, which are made by other government institutions. Those are posted in the website. And if you also go to a Google search, you will find that the page that comes first is basically a page which is being searched more by the website users. So this website is actually not maintained properly. So I actually don't want to make any comment. I've just given you some examples. So this shows how risk communication is actually planned, prepared, or disseminated. And this is a failure, I would say, definitely for the communication experts or the officers which are responsible for creating food-related communication, food security-related communication. I think this is a failure.
I completely agree with you regarding this communication. Not only,
may I differ a bit?
Yeah, you can, definitely you can.
Okay,
not.
I will take say 2 minutes only.
Please.
I would say 1-2 minutes only. So, see, you see, in fact, Dr. Tush was talking about the communication. In fact, in the later part, we will talk about the multi-sectoral approach and the role of other stakeholders as well. In fact, to me, it's not that I belong to the government job, but it's my individual evaluation that I can see the government only. I can see the government only in each and every phase of COVID, in most of the phases of COVID. But look at the BNNC website. So I have shared the BNNC website. You will find that the message about the message on nutrition. So what people should do, what people should take during this COVID situation. So it's there, and I also saw it in the IPHN website. You can, if you look at the Institute of Public Health and Nutrition website, you will find. And I know this poster has been distributed through the non-government organizations and to the development partners, and they have their own arrangement in the field level to share this to the remote areas. But a question remains still that what is the frequency of delivering this message, and to what extent it has been covered throughout the country. So that question remains, but by and large, I can say the government had plenty of initiative in terms of this communication as well.
Thank you, Ruhul Amin Bhai. I think that the point Tushar Bhai mentioned about that there is a scope to extend these risk communication activities, and
Yeah,
we
definitely.
can certainly
Just from the point of communication, I'd ask you, when you have actually restricted movement of the people to different places, when you have said that you don't come out of the home, what kind of impact a poster actually creates? Because a poster has to be seen by people and it has to be read by people. So if you put on posters in different offices, different places, but you have actually told people not to move out of the home for almost 2 months and stay at home and not come out without emergency or extreme need. So this poster is basically just printed. It has no impact basically. I have not seen it anywhere because I'm not going out anywhere. And people are actually going to markets now. They don't go to hospitals. They don't go to any government offices unless there is an emergency. People are actually going to markets and hospitals and places. They are going as basically on emergency basis. So just printing a poster is actually an initiative. But the result comes after implementation and proper implementation. The communication doesn't actually finishes with printing some posters and creating some media. I have seen DG Health producing a lot of videos, but those videos are actually not seen by people. So what's the use of creating those videos? People don't see it.
Yeah, that's true. The right mode of communication
I just don't want to hurt anyone. But the video that is being posted in the IPHN IPHN website about COVID is full of errors. And there is error. And this error video is being there and posted. As a citizen of the nation, and also as I know about as I have some medical knowledge, and I also have studies on public health, what I see is basically things being done, but not without results. We need results rather than doing a lot of things. Do one thing and do it perfectly. That is the thing that we expect. And this video is totally full of errors. It has said that corona is not that deadly and corona will be cured automatically. It is there. So why are we putting all these lockdowns and creating posters and everything? It's not that deadly. So why are we doing it? Why are we spending so much money to prevent corona? If a video says that it is not that deadly.
Yeah, I think that there is still space for updating this thing. And my understanding as a public health worker, I think that the communication, the way we are doing, there is some sort of, we are showing our responsibility that we have done something, but is it effective or not? That I need to understand properly. I think that still there is a lots of space and we have to do things proper way.
And
I just agree with
that was what I said.
Yeah. I also agree. I agree with Tushar
things
message.
not being done. I said that it is a failure on the communication. It is a failure on the communication.
Yeah, I'm sharing another issue. Like, I saw at the beginning of the corona, I was in the DG office and I found that DG office stairs is full of different COVID related poster that was made by the NCD department of our country. And they said that you have to do this thing, the one poster, colored poster. And I asked them, why did you give this poster? They said that we have distributed these posters in all over the country. The point come up that, regarding that, it's a communication. So we want to give the information that people will have the access, people will understand that information and they will act. But I don't understand that, what is the use of that poster giving in different hospitals at this moment and communicate with the people. However, I just want to come to Lolita again. Lolita, as Ruhul Amin sir shared that, the impact of, food market price and other things. What is your understanding regarding that? What type of, impact is going to happen for nutrition for this price and access of the food?
Okay, this is, I think, important to pick up from what Ruhul said. Anyway, in terms of access to food, I think we all agree that nutrition starts with what we eat. And as he rightly said, it's the second pillar of food security, access to a range of diverse foods to meet your healthy diets, to impact nutrition. Now, the Global Nutrition Report of 2020, which was launched, I think, last month, has clearly emphasized that the most vulnerable have a heightened risk of malnutrition, especially with reference to the COVID. And there is need for equitable, resilient, and sustainable food and health systems. Now we talk about food systems. Based on what Ruhul Amin Talukdar has said, and he showed some wonderful projections till date, I think we agree that food access is a part of this entire continuum of the food system, right from production to plate, as we say. I'll give you some examples of the egg and poultry sector, because FAO is doing some work on monitoring the prices and also what are the impacts. The work is in progress, but I have some figures and some updates for you, so I thought I'll quickly just let you know about it. Coming to eggs and poultry, absolutely, egg is a compact source of nourishment. It's a very good source of good quality protein, micronutrients, and several valuable nutrients that the body needs. And it's at an affordable and a competitive price. And especially for the first 1,000 days of life, we recommend taking eggs. Nearly 60 lakhs people in Bangladesh are directly or indirectly involved in this sector, and 40% of them are women contributing to social business. Now, what has happened is, because of this COVID-19, this has severely affected the poultry value chain on one side, right from input supply to product delivery and to the consumers. Now, this has been done based on the assessment that we have. And as a result, on one hand, the demand for chicken or eggs in the retail market has dropped, also due to fear. Now, this is exactly based on what Dr. Tushar said about communications. People are afraid that possibly you get COVID-19 from possibly through the markets or with chicken and eggs. There are such concerns among people. So this is one thing. And this has also lowered the profits of the poultry traders across the value chain. And this decreased the farm gate price of chicken and eggs. So as a result, this has created a disincentive for the farmers in continuing their business. Then there was some information update on the day-old chicks in terms of, they were rather going in for table eggs rather than for the broiler chickens, for the other eggs, for the laying chickens. So as a result, we find that in terms of demand, in terms of what is being produced and available for the consumer, there has been a kind of a mismatch, and there has been a disruption of this particular sector. Also, we find that because of the lockdown, this has brought up worldwide, of course, there has been a lot of disruption, as we know. And I come back a bit to the bigger picture, where the World Economic Forum has shown that probably there will be a worldwide recession, and this is affecting the global economy and country economies as well. but it is likely to last for the 3/4 of this year. At least that's what it is said in April 2020. So coming back to Bangladesh, I would like to say that with reference to the poultry and egg industry or the sector, we must think of ways by which we can valorize the market and give incentives to these producers who range across different levels. And this is an area where we can do in terms of nutrition. So when you say, how does it impact the diversity of the diet? I think this is one such area. Our colleague also made a reference to Pangash, and I'll come to that a bit later, because that's another important source of nutrition for the diet in Bangladesh, where, you know, if you have eggs and fish, at an affordable price, which it is, we'll be able to improve the diversity of the diet, which in fact can contribute to, you know, eventual nutrition outcomes. And these are not only good sources of protein and micronutrients, they're also foods which help us to build our immunity and protect the, you know, the individual from infections and, you know, other related conditions. So I think we must do something about the wet markets, the poultry, egg, and horticulture. I'll come to it a bit later. But these are key areas where people can afford to buy eggs and fish, especially local fish. So this is what I would say in terms of access. How does it impact our diets?
Yeah, thank you, Lolita. Let's come to Ruhul Amin sir again. Sir, I know that you have a vast experience in the policy issues. Can you just share that the available policies which we have for agriculture, food, nutrition, and other issues? Do you think that all policies, perspective can cover this COVID-29 issues? And if not, how we can adapt this thing and make changes in the policies in near future? What is your comments?
Yeah, thank you. Thank you for asking the policy question. In fact, I like to start from where Lolita ends up. She said that the government has to come up with, or the state has to come up with incentives. And I also said that I only saw the government face across each and every phases of COVID. So if you talk about incentives, that is there built in all the relevant policies of the government in the first place. You can see Lolita talked about incentives in the poultry sector, and Dr. Tushar also shed light on that. How much incentives have been announced by the government, and we are at different stages of working out the modalities, and some incentives have already been started to be in position. You heard about the incentives in the SME sector. You heard about the incentives in the agriculture sector that was announced by the government in terms of inputs as well as the output. In one side, government is providing input support and also in the output support. And with the specific context of COVID, you can see that government has extended the coverage of these incentives as in terms of money as well as number of beneficiaries. And you will also find that the government has also announced, and it's already on board, the reduction of interest rates. Interest rate, earlier it was on 2-3 products. Now the coverage have been increased to other products as well. So the response has been very clear. See, in one sense, it has extended the coverage. The other sense, it has extended the amount of money. And the third sense is that the government has extended avenues of different incentives. Now, coming to your question on the policy, and if you look at the policies of Bangladesh, which cuts across nutrition, If we talk about the core policy is the national nutrition policy that was formulated by the current current regime that in their earlier tenure, and the second of its kind national plan of action for nutrition. And the relevant policies are the government food policy and the newly developed food and nutrition security policy, the CIP country development plan, the agriculture policy, the fisheries policy, all those, the women development policy, all those actually covers in one way or other the nutritional aspect, nutritional improvements of the people of the country. Now, in respect to COVID, you can look at it by two, three means. Number one, in national nutrition policy, it has not clearly talked about COVID, but it has clearly talked about emergencies. How you have to tackle it. You see, emergency can come in different forms.
Yes.
Emergency could be natural, emergency could be man-made, emergency could be due to the
disasters.
That is on
Natural.
So it has says in general about the emergencies, how we need to tackle the emergencies. If you allow me, I can again share it for your
Please go ahead.
So where it is.
At the bottom.
Can you see it?
Not yet.
Not yet? Okay.
But just to supplement what Dr. Okay.
Let me finish. You see, it says National Nutrition Policy. It says ensure adequate nutrition for the people in emergencies, natural disaster, epidemic, or conflict. So it is there in the and further in application of the related act, especially the Breast Milk Substitute Act, infant food, commercially prepared complementary food, and accessories thereof. So the key areas, it said that extending nutrition actions in existing disaster preparedness and response management strategies. I see some, and also the major activities that have been outlined. And NPAN has come up with further clarification of what policy says. It says extending preparedness for nutrition in emergencies using the nutrition cluster. You know that this nutrition cluster belongs to is associated with the local consultative group. Lolita, you bear me out if I am wrong. This nutrition cluster, it is an institutional mechanism that is purely with the development partners.
Yes.
And they have
the food security cluster as well. Yes.
Yeah. They have food security cluster as well.
It is now actually working together in this current situation.
The issue I like to raise that, well, although the policy has come up, the policy does not detail many things.
Yes.
So it is the actors who are responsible for detailing the policy to make it happen. Especially, to me, we might have a different, a separate action plan for disaster preparedness during the emergencies. That means in the name of the nutrition in emergencies. So that is one area I think we have to look into. But no matter whether the actual action plan is there or not, as the policy is there and the actors are there, not only the government, you know that this National Plan of Action for Nutrition and the Disaster Management Action Plan. So with these, combining these two, the actors, not only the government, also the other actors, the non-government organizations, the development partners, the donors, the multilateral organizations like FAO, World Bank, and others, I think they have some responsibility to come up to the situation, to address the impacts, ensuing impacts, and also to reduce the residual impacts in the post-COVID, not only during COVID but also in the post-COVID situation.
Yeah, thank you,
Next
sir.
topic.
I just come again to Tushar bhai. Tushar bhai, as you heard about, there are lots of policy issues covered this emergency situation. Lolita also mentioned about the what type of impact can happen in our country for this COVID-19, and you have talked about that communications need to be strengthened for really reach to the people. But my point is that my point and my understanding is that communication is happening in one way. People are taking decision from the upper level and they're giving the decision, and that information is coming to the people. And we are not sure that how people are getting that information or not. But I think that it should be two-way communication. Like as we are discussing today, that information also need to go to the policymakers to understand that why we are talking, why we are trying to give some information, as they can accommodate that information or suggestion within their activities, which is helpful for the people. Do you think that two-way communication is happening? If it is not happened, then how we can really make a way to ensure that our voice can raise up to the policymakers?
If you say that there is a access plan for food marketing and food consumption, food sales and purchase during emergency period, there should be a communication guideline and communication planning for emergencies also. The problem with our emergency planning was that nobody, when making the plan, thought that a country can be the total geographical location of the country could be under the same disaster. They thought that in South there would be cyclones, in Dhaka there would be earthquakes, in Jessore there would be flood. And we will always have some free area from where we can operate and come with relief or come with some kind of assistance for the affected area. But nobody actually thought of a pandemic. And that's why how to tackle the communication need during a pandemic was not actually thought. And that's why the communication is actually failing. We have to understand the traffic of people when we create a communication. So what kind of media are people using now? Where are people going now? What are the media that people are using now? Where are people turning for information? So if we really want to create an effective communication plan, we have to focus on the pattern of use of media of the consumers. So are really people standing in front of a wall and reading posters? I don't think they are doing that. So our communication should be more digital now than manual. And our communication should be more verbal now than written, because the huge amount of population being affected by this pandemic don't know how to read or write. They can read or write to a certain extent, say a few lines. They don't understand all the terms and jargons that are being used in the communication. So we have to make it easier for people to understand. People want to live, they want to save their lives, and they want to save their lives by two things. They want to protect themselves from COVID, and they want to have proper food so that they can live. They will die out of two reasons. Either they will die by COVID, or they will die out of hunger. So we have to give them food and sustain their lives so that they can effectively protect themselves from this disease and survive until the world changes. So I see a basic flaw, Shamin, when all our authorities created the communication, because they were fixed to the ideas prevailing before this COVID situation. So they're doing the same thing. They're doing printing, they're distributing posters, they're putting in error messages. Let me tell you about egg. The same person who is on the website told in Jamuna television that virus can come from eggs. And I can prove that within 7 days, the sales of egg became down because people trust him. And people thought that they can be infected from eggs. And it was broadcasted in broad daylight in a TV channel where he said that you have to clean the egg, virus can come from eggs. Be careful about eggs. So these kind of communications, whenever we say something, it has to be very much tested and has to be perfect. It is wise not to give the right information even, but it is very wrong to give a wrong information to the people. So then more people will be affected. So I would say that there should be a comprehensive single point communication plan about the COVID and the food crisis and how we can tackle the food crisis or the need of food and access to food during this COVID period. We have to assure people first that there would be no shortage in the market. The first reaction of the people was to go to the market and buy things that are not necessary for them. The price of rice actually rose because of this. People bought more rice for the next 3-4 months. Then government came and said that no, we have food, and government was always active. Government tried to protect this. But the problem is the communication people. It is not actually everybody's responsibility to create the communication. The communication people should be held responsible for this because people should be assured that there will be no crisis in the market. Then people have to be assured that food is on the pipeline. All these communications were done by whom? Our Honorable Prime Minister. She actually said this because she understood that this is the message that should be given to the people. And that is my question. This was the responsibility of the communication people. But our Honorable Prime Minister came to television and said, we have 4 months savings. We have 4 months stock of food. Don't worry about crisis. New crop is coming. We have taken action. We are giving loan to everybody. She's the one who actually communicated. But isn't it too much for her, like to say everything and everything? It is the responsibility of the people who are managing the communication office. They are giving the wrong information. She's rectifying it. She's the one who's basically capable of understanding the people's mind. That is where I say that we have to create effective single point communication. We have to make it accessible in the places where people are going and using the media, and then we have to make it easily understood by the people. And we have to assure people first. Then we have to tell them where they can get the food. And then we have to tell them, you don't have to eat everything now. You have to be cautious about your food buying habit. So stop buying cookies, but stop buying cookies, but buy things that will give you enough nutrition to combat COVID. You need protein, you need fat, you need a little bit of carbohydrate. You need to plan your food habit, and you need to plan your shopping habit also. So that is how you can actually survive, because there is economic crisis and everybody has lost a part of their income. Mostly businessmen were affected. Then people are losing their job. So the budget is being cut in. So we also have to have certain kind of interactive sites where people can go compare price and choose food according to their pocket. But we don't have all those activities. Our communication is still in the old fashion, and we are doing the same thing, creating television advertisement, creating television communication. Today, I went to Bangladesh television and saw there is a drama being aired about nutrition and food. But this drama should be stopped now, and there should be more small adverts where people would be said that don't worry about food crisis, drink a lot of water, be careful about over shopping, and like buy this and this, and create a better list of foods in your everyday consumption. These are the things that we should be saying. But we are still airing the drama that was created before COVID. Our language should be changed, Samir.
Yeah. Yeah, thank you, Tushar bhai. We'll come back again to you,
Yes.
Lolita. As we are, going through our limited time, so
Yeah.
last point, I come to you as you are a researcher and you did lots of research in food and nutrition sector. Let me know your suggestion that during this COVID-19, what type of research we need to do in Bangladesh, specifically for nutrition and nutrition communication, as well as, if you consider this Southeast Asian regional is some sort of same culture and same, perspective. If I ask you to take a regional research, what type of research you will suggest to do?
Okay, I think this is a difficult question. I'd like to make it very concise. Just before I answer this question, just to respond to what Dr. Tushar has said, just today, the Ministry of Agriculture has released a video. It's with me. I don't think I can share it, and time would go, on fruits in Bangladesh, which are produced in large amounts, like lychee, then pineapple, anarosh, and as well as guava. Beautiful video, totally in Bengali, sung very nicely, and FAO was involved in that as well. It's just launched today. I think we must share it with everybody. It's on fruits, because horticulture is doing very well in Bangladesh, as you know. I think there are things we need to, as our communication expert rightly said, we need to stop into this, just having posters. Even our poster which we produced with BNNC, that itself can be made more visual in terms of, make it live and active in terms of message. I think there's a lot to be done on that. Coming back to research. Okay, now COVID has happened just now, but there have been some policy priorities in Bangladesh for nutrition, which actually are, I would say not perennial, but which actually are relevant today. One of the, I think Dr. Tushar mentioned, and even Ruhul Amin Talukdar mentioned about the kind of foods that we must eat, what we should eat. I agree. We talk about today in Bangladesh, people have got more money, the foods are diversifying, although slow. But if you look at the latest statistics, the consumption of rice has dropped, and there is people are taking more non-cereal foods. Yes, there are gaps with reference to specific foods like milk. Then I would say even with reference to animal source foods, lentils are extremely low. Interestingly, oil is increasing, and this is not a very good sign. Sugars are also increasing. So relative to the total calories and relative to your recommended dietary allowances or normative requirements, there are some, I would say, certain foods where we are taking more, which we shouldn't be doing. Similarly, fruits and vegetables, we are taking only half of what is our normative requirement. Now, why, what, that's another issue, but certainly we know the reasons why this gap exists, and this is causing some gap in our both food and nutrient gaps. And we are aware of this. And Bangladesh has been doing work on this, what we call as establishing a desirable dietary pattern. Now, coming to COVID, is this relevant in today's situation? Absolutely. It's even more relevant today than before. We are taking a food systems approach, and as Ruhul Amin Talukdar rightly said, nutrition is cutting across all policies, and we've all been part of this process and have tried to make sure that it's not just sensitization, but we're trying to implement it. About the policies we can talk about later, but coming to the research, I think one of the important points is when we talk about diets which are diversifying at a slow rate, we need to understand the gap between what is produced, the supply of those safe and nutritious foods, and what we consume. Now, this is okay to say on a very theoretical level, but we actually have data today that what are these gaps. So one of the research that we've already undertaken, and this is one of the needs in today's situation, is the nutrient density, affordability of a typical food basket for people across the lifespan, that is 1,000 days, adolescents and elderly, and at what price can you buy this? Now, this is an important research, and we've initiated this with Dhaka University, with the team over there. It's not that simple. There are certain formulas, there are certain methodologies by which you not only compute this score, what you call as the nutrient density. Basically, in simple terms, what is nutrient density? It is the nutrient return for the calories. Ideally, a nutrient-dense food should be low in calories and high in nutrients. This can be protein, micronutrients, and whatever. We can talk about it more in detail when we get a chance again. But this is what we mean by nutrient density. Now, coming to that, are these diets affordable? Yes. If you look at a traditional diet and if you look at what is available, because Bangladesh has been doing well in many of the food commodities in terms of production, supply and access, yes, there are challenges, but I think that is an area where we need to do it. So if we look at the nutrient return for the money spent, I think that's an area where research needs to be done. That is really what is going on. If you segment the foods and you group it up, you might be able to get exchanges that you can take fish and eggs, or should we take so much of beef, or should we take this vegetable instead of the other one, things like that. So we have segmented foods which can be used, and this research is actually currently started. And I'm happy to let you know that hopefully by the end of the year or early next year, we will have some kind of draft findings. Because fruits and vegetables, it's not just about micronutrients. There are phytonutrients, there are antioxidants, many of them which are important from the point of view of your, not only for nutrition, but as well as for COVID. Then the nutrient density and the cost of food. So this is again related to the entire thing. Now we have something called minimum dietary diversity for women, which is again being used as an indicator. Now this is again something, out of those 10 foods, can we afford at least 5? We've done a lot of work on this, but in terms of validating this for the affordability, I think that is where we have the challenge. And coming to a very practical intervention which was done just few months ago when we all got together, and Dr. Rahul, I think you were also part of it, we actually came up with 3 food baskets using staples and fortified rice and different things. Vegetables were not there. This was actually rolled out to the community through the Ministry of Disaster Management as well as Ministry of Health and Family Welfare. Now, in terms of monitoring all this itself is an area of action research. The second research that I would say which is very important in the current situation is there is paucity of data on food loss and waste. We know very well that we must establish a methodology for finding out how much of food, how much of our different commodities are actually lost at the site of post-production, post-harvest losses, and then by the time the consumer has it. So this we don't have. Roughly for Bangladesh, they have shown about 24 to 44% loss occurs across the board in different food commodities. And when we say food losses, it also results in some amount of micronutrient losses. I'm not talking about the cooking, that's another issue, but actually production, post-production losses. So we need to measure this. This is also one of the SDG indicators, and the Ministry of Food is taking an active role, and FAO is working in this regard with them. The third thing is a total diet study. How can we get safe, healthy foods and look at the dietary risk exposure to the contaminants? So this again is some work that is being done with the Bangladesh Agricultural University Soil Science Department. So these are, I'm just highlighting 3. There are many more in terms of, many more means key policy issues. These are some of the important areas where we need to focus so that we are able to give the population diverse, safe diets which can impact nutrition, very, very important in terms of both the COVID and non-COVID situation.
Lolita, thank you. I just want to, one point I want to raise in terms of practical perspective. Yeah, a practical perspective. I think that Ruhul Amin sir also can consider that when I was visiting in different hospitals and slums areas, I have an understanding that people are really facing problem regarding the nutrition and food for the COVID patient and COVID affected families. So I think that there is a need to, identify the, what type of nutritious food especially we give for the COVID patient and their family, and specifically, unconscious or, admitted hospital patient. So there is a really gap in terms of hospital management to provide the food for this COVID patient. So that I hope that you will take forward this agenda. I'll try to do something for this patient. Just come to the Ruhul Amin sir. Sir, I have one information. I'm not sure about that information, but I'm sure that you may know this situation. Like after 1970, after we independent, like if you look at that food production in 1970, 71, 72, 3 and 4, it increased. And in terms of the investment of the agriculture and food, government also invests a lot. But there was a big problem in terms of the excess of the food. And due to that problem, the excess of the food, there was a big famine in 1974. And that time the political government faced lots of problems. And some people also said that that was one of the perspective of of the political achievement in 1971 was disrupted due to this excess of food. So as we are saying that during this COVID-19, our production is increasing. People are, don't worry about this production, but we may need to really cautiously think about to ensure this access in terms of market management and ensure this access of the food for the poor people specifically. Like at this moment, 20% people are really poor. And if we turn into political agenda, then that might be a big problem for this government too. So we really need to be very focused and think about this, how we can ensure and help the government not to face any political problem. So in that perspective, what is your suggestion and what type of intervention you like to do to help our government to ensure the access of the food for the poor people?
Thank you, Dr. Shamim, for the question. In fact, in your questioning, you have partly given the answer. The thing is, if you just analyze the strategy of the government, see, not only at the onset of COVID, but also the current political government, since 2009, and not only 2009, also in their earlier tenure, 1996 to 2001, they had put tremendous impetus on not only on production sufficiency, but also on how to improve access. As I said in the beginning of my talk, not only economic access, but also physical access. And you have seen that in line with their lessons, they have managed to enhance the capacity of the government in delivering services, to enhance the production in one place, to market the produce, and also to focus on the people who have limited economic access. That means the entitled, the poor and low-income people. If you look at the amount of food distribution that is being held during government, it was not seen after the so-called market liberalization in the late in the 80s and also early 90s. At that time, you will find that the distribution from the government was squeezed, and with the assumption of power by this political government, they have started to enhance the coverage of distribution as well. That means even if you see after the COVID, the response, the government started OMS operation, then it pulls back to make it more targeted. That means to make the distribution much more effective. And in that line, you can see from the government data that plenty of people have been covered. It's around 50 million people have been covered already over 50 million people have been already covered by the food distribution and cash distribution. So the policy, to me, is in the right track. But two point I like to mention in the light of discussion of Lolita and also Dr. Tushar. In fact, we have the policy, we have the plan, but we need to follow that. We need to see what is there in the book. Say, for example, the issue of communication that Dr. Tushar mentioned. In fact, it is mentioned in the government strategy of SBCC of 2016. It is there already. That means the communication has to have some purpose. It has to follow some norms. It has to follow some modalities based on the audience, based on the specific situation. What Dr. Tushar said, actually, that is there in the framework. But as actor like me, we have to follow that. We have to look on those, what is there in the policy, what is there in the strategy, and we need to follow that. And he has also rightly mentioned about the way the Prime Minister acted upon. See, at one point she outlined 31 directives, instructions to the people of the country, and you can see it has all in it. It has in one way, it has assuring the people that we are behind you, assuring the people that we have enough food, assuring the people that don't get panic, assuring the people that we have all the services. And I am happy to see that even at this point of panicking and point of sort of inability to access the market by the consumers, you will find that the COVID website, I think it's a very good website that government has come up with. It has the services, it has the directions where services can be obtained. It has the services where food can be obtained. It has the services where your diagnostic facilities could be obtained. And it has the, and even not only that, by Upazila and by district, they have provided the information, the volunteering organizations, name of the volunteering organizations and their contact number. If you are unable to access to market, unable to access to food, you call them and they will try to ensure you to fulfill your requirements. So I think in one way that I said that the policy is well documented. The second point is, okay, we have the policy, we need to articulate some specific strategy or action plan for emergencies like this. That I said in my previous intervention, that should be there. And number 3 is, as actor, we need to base on those documents. Not sufficient that we have the documents, so we need to follow those documents as well. So that is my submission. And in the point of implementation, I like to emphasize that it's not only during this such emergency the government will suffice. The other sectors, the non-government organizations, the DPs. You see, many people can be critical to government or government activities, but you must have to act, not to criticize. You must have to act. Each and every actors has to show their responsibility. Has to come up with the situation. Please, I think being critical will not be a solution. Yeah. Being part of the, if you think that you are part of the solution, you please come up. So as I said, for nutrition is very much important. Nutrition is a multi-sectoral issue, and in a situation like COVID, is much more than needed than in the normal period. I stop here.
Thank you, sir. Our last question to Tushar Bhai. Tushar Bhai, as you are more pro people and proactive for the people those are suffering most. So my question to you that if you look at, there is a huge number of slums people living in Dhaka city and near the Dhaka cities too, mainly most affected areas of Bangladesh like Gazipur, Narayanganj. There are lots of poor people, and most of them in these areas, people also do work in the garments industries too. And if you look at the Chittagong people also, there is a lots of garments, and most poor people do work in the garments industries. So, what is your understanding how garments industries and like BGMEA, BKMEA, or our Commerce Ministry, Labor Ministry, as well as if you look at for slum people, that's local government ministries, how they are playing the role in terms of communications for giving information for the poor and garments worker people, and what is your recommendation? How not only that in a situation you tell that how they can act for giving the information for this group of people.
Well, first, one thing I have to make clear is that I was basically critical of the communications, not critical of any kind of readiness or the capability of the system, because the system has certain capability. And in last 20 or 30 years, we have actually attained a lot of success in nutrition as well as food and other sectors. So we have actually doubled, or in some places, we have tripled our food intake. We have tripled our income. We have tripled many things, and we have actually achieved a lot of milestones. The problem is when in front of an emergency, are we really acting in the right manner so that we can sustain this development? The things that we have achieved in last 30 years, we just don't want to lose it for some communication error, some small errors, and that's why we have to be very cautious and careful, because this is a new situation for the whole world, and we should act more intensively in communicating to the people, because our people are not as educated as many countries of the world. Our communication system is different than other parts of the world, and that's why I was a bit critical, because we have to identify the problems of communication. Because why people are panicking, why people are taking homeopathy, allopathy, and all other drugs. This has happened in the whole world. But in a country like us, we just cannot afford buying useless medicine. Useless medicine could be bought by a certain countries of the world where they are developed. But if our people spend money in useless medicine, they will have less money to buy food. If they buy useless food, then they will have less money to buy medicine. So we are in a different scenario. That's why I would say that we have to be very careful about communicating, and we have to communicate this. Like you have asked the question, that is there any possibility of facing a crisis like 1974, where there was enough food, but distribution and communication were the problem? I think that kind of a scenario is possible anymore in Bangladesh, because now we are more connected, we are digitally connected. There is a huge supply chain network, which is not government, but non-government supply chain network. And there is a delivery system developed side by side with the government. There is a non-government delivery system. So I don't think that kind of a crisis is imminent. But the crisis that is imminent is like people might panic, and like people have bought toilet papers in USA, maybe people will be buying sugar here, because our people follow rumors. So people started to buying salt. That has started in the primary phase of the COVID. People suddenly started buying salt out of no reason. So these are the things that we have to be careful about. Now you have asked me for the slum people. The first thing that we could do is like BGMEA and other organizations where they have their workers living in the slum. They could take comprehensive action of keeping them protected there, because the main goal is to keep them protected so the labor force can be used, and that labor force could produce for us and earn money also. So first thing is health and food. So I would suggest that all the governments and other organizations where it is labor intensive, they should have a database. They should have a database and know where their workers are living, and try to share information between each other and create a certain zone where all the garments workers would be living now, so that we can protect the zone, train them for health practice, provide enough soap, water, running water, shower area and other places, so that even if they live in the slum, they live in a healthy slum and live where we can take effective precaution. The second thing is food. They are now cooking their food separately. But there are large kitchens which are not running now in Dhaka, especially, and also in Chittagong, and most of the garment factories are in Dhaka and Chittagong. So these organizations can rent these large kitchens and order them, say, 10,000, 20,000, 30,000 meals and get it supplied right on time, so that they don't have to cook their food. Because for cooking their food, they have to go to the market, they have to buy it differently. They cannot have stock in their home because they don't have storage area, separate storage area. So they have to go to market every day, they have to buy it every day, they have to eat it every day. So if we let them cook in this situation, they are more prone to infection, because they will be going to market, they will be going to different places, they will be bargaining. We just have to quarantine them in a public fashion. It's like a social quarantine. So these are the steps that large factories should have taken. Now we just have to give them a different kind of solution for the crisis period. After this crisis is over, they can go back to the normal life again. But during this crisis, if we really want them to work in the garments factory, then another thing they should do is, like, they should use mass transport to bring them to factory and send them to home. And another thing they should be stopping is letting them go out in the lunchtime. Most of the workers, they come out of the factory, walk in a group and go back to their home as fast as possible, eat and come back again to the factories. So this also creates the load of disinfection again on the factories. Rather, keep them in the factory, provide food inside the factory, give them lunch inside the factory, and give some subsidy, and also deduct some money for the food from their salary, but give them proper food in lunchtime. This is another thing they should have taken. Rather, what they are doing now, you see, they have created a laboratory to find out the infected labor force in their factories. This is a wrong approach. Already government is doing that. Why do you have to test your people separately? You don't have to do that. You just don't need it. This is being done by the factories because they just want to know who are infected and just get rid of them. This is a wrong approach. Rather, government is there to take care of their health. You take care of their food, their workplace safety, and their living safety. That is how our factories should be looking at it. We should be taking care of their food. We should be taking care of their medicine. We should be taking care of where they're living. And we should train them properly so that they can protect themselves by wearing masks, washing hands, and keeping away from each other. This is the thing that we should be doing. Rather, we are now setting up laboratories to test COVID. This is the wrong approach, because every factory is situated in some place, say in Gazipur, say in Dhaka, or say in other places. So testing facilities there. You just don't have to test them separately. And these testing facilities are actually testing only 400, 500 people in a day. This is inadequate for the garment factories also. But setting up a lab, the money that they have spent for this, they could use this money to effectively train their people so that they can stay away from the infection. This is the wrong approach that we are taking, and that's where communication comes. If we create rightly directed communication material, properly focused, then we could effectively fight the information scarcity or the lack of information. And if we can provide right information, we can also reduce the spending in other places.
Thank you, Tushar bhai. Thank you, Tushar bhai, for your highly I should highly appreciate your ideas to give the lunch food in the garments factory during this COVID period, or maybe they can continue this, providing this lunch. That is very useful for them. Due to most of the garments workers, they go to their home for taking lunch and come back again. So that is very useful, suggestion for us. Before I finish, just I want to request Lolita, do you have any comments within 50 seconds?
Yeah, no, sure. On this issue of foods, I think delivery services that can bring food from the markets or restaurants, and this also helps to increase business for the food business people, and also enhance the demand of consumers. In fact, this is happening in Thailand. I think we have to change now. We've got to slightly adjust the business in such a way that people get the food, and because restaurants and hotels are getting closed, that's the business has been badly affected. But you can have healthy meals which are being sold at now price. Of course, we've got to look at that. But the basic meal, and if that can be given across through a delivery chain, I think that will be very helpful. I agree with you.
Thank you, Lolita. Ruhul Amin sir, just within 50 seconds, do you have any final recommendation? মাইকটা স্যার আপনার সাউন্ডটা একটু অন করে নিন সাউন্ড সিস্টেমটা জি
The thing is, we also have been facing plenty the challenge of misinformation as well. I think that is one of the area where the government is sometimes, to me, government has disseminated plenty of information through the mobile apps, through the electronic media, through the print media, through other means. Maybe it might have some deficiency, as Dr. Tushar was saying, that in the right mode, right audience, that sort of thing maybe we need to improve. But at the same time, we need to work out how we can overcome the challenge of misinformation. So that is my first point. And the second point is about the research. We have plenty of information, but we need to understand the real challenge, real way out. Not only the challenge, but also the way out.
Correct.
We have started gathering the information, and Lolita has hinted some of the items they are focusing on. And we from BBS and also from National Information Platform for Nutrition, we have started doing something, but we have some limitation. So we need to work on the secondary information only. But I understand that in due course we will work on that limitation. Without proper evidence, it's difficult to go with in-depth interventions. You see, in Bangladesh, we have plenty of policy suggestions, but we have little research on the actions, the modality, which modality will be good, better, which modality will be more penetrating to the remote audience. I think that sort of research we need to organize. And the third point is, as I mentioned, the multi-sectoral engagement. It's not only, you see, we can talk about the government, what they have done, what they have not, but please, the other sector must come out.
Thank you, sir. Thank you, sir. Tushar bhai, last recommendation and final recommendation before we close.
The only recommendation is like there should be I would say a coordinated approach, and information should come from a single point, because people want to find the right information. So in USA or in other places, you will find that regarding disease, they go to CDC. So regarding market price, they go to a certain website. So information, there should be certain places where we would just certify them that if you want the right information, go there. And for any other information, we don't take any responsibilities. This clear message should be given to people. That this is the place where you look for information, or these are the signs that you look for. And if you don't have this, we don't take any responsibility of these informations. So this is one thing that has to be really clarified to the people. And there should be assurance to the people, because this is totally a new situation. People are panicking. People are having mental impact of this disease situation. There is economic impact. There is a social impact. There is family problems. Many things that those we actually ignored or did not face in our previous period before COVID are all coming down. So there should be a comprehensive and a coordinated approach regarding communication, so that people don't get misinformation and people don't get information which would confuse them. This is the only thing. If you can do that, then other works would be easier, because all information from different places could be put in the same place and people would know this is the thing to follow and they would follow instantly. Now that everybody is giving information from everywhere, people are basically confused and not following anything. They are actually they're doing information shopping, and they're taking one from here, one from here, one from there, and making their own recipe of information. So they are following Ayurveda, they are following allopathic, they are following, say, they're taking a Chinese soup with, say, Bangladeshi dal. So this is what is happening. So I would say that just create a single point of communication and certify it, endorse it, and push every information through the same channel. So everybody coming for information would shop it from one place.
Thank you so much. Dear audience, we are going to close today. And thank you, Lolita, for your time and thoughtful suggestion. Ruhul Amin sir, thank you so much, for your in-depth analysis and discuss the issues we need to do. And Tushar bhai, thank you so much. Thank you for your suggestion for communication perspective. I think this is one of the most important issues at this moment, and for the people in Bangladesh, not in terms of nutrition perspective, psychological, mental, and fairness, which is happening in our country, that needs to be focused from the government side as well as from the all stakeholders. I think that if you look at the situation at this moment, yesterday I tried to have a ICU for a patient. I did not get any ICU. I heard that today there is no seat in any hospital. So we don't know that what is going to happen in tomorrow. So at this moment, communication may be the major tools to handle the situation. So in terms of nutrition discussion we have done, but the issue came up for communication. I think government should take forward this agenda and try to do a one channel information giving for the people. Yeah, it's very important. And thank you. We are going to close, and we will come up again this week with our 7th nutrition policy dialogue. And thanks from all the team member of Eminence. Thank you so much. Bye.
Bye-bye. Have a good evening. Bye.
Thank you, Eminence, and I'm really honored to share the same screen.
Yes.
She's a very eminent person, Lolita. And,
might be good to follow this up again.
I'm very grateful that I could share the screen with you. Thank you, Sham.
Thank you. Same here, likewise.
Thank you, sir. Thank you, Ruhul Amin sir.